And turning now to the numbers on the pandemic as the coronavirus continues to spread across Arizona. The Department of Health says that our state has recorded more than 685,000 cases of the virus and more than 11,200 Arizonans have died since last year.
Hospitals now overwhelmed as they work to care for the sickest with COVID. But new data is providing a little bit of hope today.
Team 12's Colleen Sikora is looking what a potential dip in COVID-related numbers could mean.
Both the number of people in the hospital with COVID-19 and those in the ICU have been slowly inching down over the last week. But those on the front line say we are not confidently past this surge yet.
It's kind of been unreal what my team has seen.
Jody Johnson and her team of nurses have been fighting the pandemic for 10 months in a Valley Hospital's med-surg floor and say this latest surge has been the worst she's seen.
We saw more patients. They seem to be sicker.
Now, data from the state health department shows in the number of COVID-19 patients in the hospital right now and in the ICU hit an all-time high on January 11th. Since then, it's been slowly shifting directions.
There was a time when we were getting more and more patients every single day, and that seems to have slowed down.
Johnson calls the change a plateau.
While hope is out there, we are not there yet.
Chief Clinical Director of Honor Health, Dr. Stephanie Jackson, agrees. Last week, she and fellow clinical officers of Valley Hospitals stood together, outlining how close they're getting to crisis and triage levels of care, wanting to see change.
Hopefully hearing our messaging that it's really important to follow the guidelines right now.
But Jackson believes this plateau can easily go the other direction.
I think we're in a critical point and really a race against time to vaccinate as many people as we can before we get another wave.
And while there is a change in the data, it hasn't changed the taxing day to day for Johnson.
It's a different type of nursing. It is true pandemic care.
Both of them say it's critical right now to continue to wash your hands, stay home when you can, and wear your mask, and get the vaccine when it's available to you to help slow the spread. Colleen Sikora, 12 News.